Sweaty, you were the first one to comment this morning. All right, good morning, folks. Looks like people are slow signing on. Facebook's probably not giving notices. I'm actually early for once, but that's because I've got a million things to do today. I wanted to get out to the farm and get some work going. The good news is my mother is home, and at this point, we think that we will not be playing the revolving door in and out of the hospital, and that we are well on our way to a complete recovery. So, no music, really? All right. Well, no wonder people aren't signing on. Okay. So, here, oh, I know why. All right, guys, my microphone wasn't plugged in. That's why you didn't get music. Start over. Give me 1 second. Oh, Lordy. Try that again. Facebook not giving messages. Well, of course not. We need a little help from them and we're not getting it, but we'll get people on. And it looks like people are up bright and early opening their Friday 5 because we got a ton of people who have downloaded the pet personality profile, which is what the Friday 5 was about this morning. So that was awesome. So if you haven't read it yet, open it up. It's got really good information. Yeah, we're home. We're staying home. Okay. All right. Now we're waking people up a little bit. Okay. So somebody sent me an email and asked me about stem cell therapy for they have a young dog and they wanted to know whether it was worth banking stem cells while their dog is young for potential use later in life. Good morning, Dennis Becker from All Provide. Um, and it's a really interesting concept. So first we'll talk about regenerative medicine in general. Regenerative medicine is using the body, cells from your own body to bring about healing. And there's two different kinds of cells that we generally talk about using. One is something called stem cells, and then the second one is platelets from our bloodstream. So platelet-rich plasma is actually an easier process for your pet than the stem cell therapy. Platelet-rich plasma is basically getting a blood sample from your pet, and then it goes through a special centrifuge and filter system. And what it does is concentrate. I don't know if my computer does it. Concentrates the platelets. And then those platelets are that platelet-rich plasma, which has lots of good proteins and antibodies and things in it, is then injected back in to the area of the body where we want it to work. So these things are most commonly used for like ligament tears, arthritis, joint problems. And so it's pretty easy to take that platelet-rich plasma that we drew blood or the stem cells, and I'll talk about that, and we can then inject it back into, say, a hip joint with hip dysplasia or a stifle joint that has a torn cruciate ligament. And these specialized cells are very capable of bringing about healing and regeneration of damaged tissue. So that's why it's called regenerative medicine, and it's using the body's own cells. So we don't have a risk of rejection. For instance, if you got a transplant from a different animal, then the body could reject that because it's not itself. But when we're injecting cells that actually came from our own body or from the dog's own or cat's own body, then the body says, oh, I recognize that. That's good. I'm not going to attack it. So the platelet-rich plasma is pretty easy. Your animal basically has to give a decent quantity of blood, sit around for a few hours while the platelets are concentrated into the platelet-rich plasma, and then have the injections done. Depending on where you're injecting into joints can be very painful. So a lot of times the animals have to have some sort of sedation or anesthesia in order to have the injections performed. Stem cells are a little trickier. So what is a stem cell? A stem cell is kind of an immature cell. It's a baby cell, and they kind of reside all over the body, but we can harvest them either from bone marrow or from fat tissue. Getting a bone marrow aspirate has a high risk of infection or higher risk of infection when you enter the bone marrow, and it's a very painful procedure. To harvest fat, which is generally what we're doing when we're talking about storing stem cells, harvesting and storing stem cells, say from a young animal that we want to use later in life. Um, so, for instance, when your female goes in to be spayed, you could say to your veterinarian, hey, I want to harvest and store those fat and stem cells so that if my pet has a problem later in life where I want to do regenerative medicine, I've got those cells and they're in storage. It's not cheap to do. I can't remember what the annual storage fee is. Um, and a lot of these companies, these regenerative medicine companies, are located out in California, but they do have special methods for the cells to be shipped to them. And then the cells undergo a special process to extract the stem cells, concentrate them, potentiate them, which means make them even stronger, make them work better. And so stem cells have the ability to transform themselves into really any tissue in the body. So we might inject them into a joint where the cartilage has been degraded or where there's a torn ligament. The stem cells go in there and they can recognize those areas where there's damage or there's destruction, and they can start multiplying and kind of repairing and regenerating the cartilage or the ligament. Um, they also can be injected IV, so intravenously. So generally, when I did stem cell, I would harvest the fat, and for large dogs, a lot of times the fat covering over the rib cage, you can get enough fat from there. We don't have to go into the abdomen. Kitty cats, it can be a little harder to get enough fat, although my fat cat Mittens, he's got enough blubber everywhere, I could get some healthy fat. You cannot use lipoma tissue, so you can't take, because that's abnormal fat. So you don't want to have a lipoma taken off and then ship that in for stem cell concentration. So it has to be healthy fat. Um, so when I would do it, so for instance, I had a German Shepherd, had hip dysplasia, arthritis in both elbows because the dog had elbow dysplasia as a youngster, and it had blown out both cruciates, so both stifles were bad. So we harvested a large amount of fat off the rib cage. The dog was about 115 pounds. Got a large amount of fat, sent it off to California to have it concentrated and have the stem cells taken out. And then they sent those stem cells back to us. And I sedated the dog again. So this is a double sedation procedure, and it's not cheap. But we took those stem cells, we injected them into both hips, both stifles, both elbows, and then saved a small amount of it and injected it intravenously. And when you inject it intravenously, it will kind of search out the areas in the body that need help. So it is being used even more now for things like cardiomyopathy, heart disease, where there's damage to the heart tissue. It's being used for liver disease, chronic kidney failure, or kidney damage. So it can be used in a lot of different ways. That particular dog that I was talking about, that German Shepherd, that was the first dog I had done it on. This was many, many years ago when this was very, very early in this science. And the owner came to me and asked me if I would do it. And I said, sure, I'll learn how to do it. And if you're willing to let your dog be my guinea pig, and he was. The dog did great. The dog, within a few weeks, was racing around the park, happy, and we repeated it about a year later. He banked the rest of his stem cells that weren't used and had them multiply. And then a year later, we were able to go through the procedure again. We didn't have to harvest, we just re injected. And it made more improvement in the dog. So, for some animals, we will see improvement within a few days. With others, it might be a few weeks before you're really getting that regenerative effect. Um, so it is a really cool therapy. Um, uh, can some animals not respond? Sure, that's a possibility. But I have to say, this dog, the first one that I did it in, and we did it multiple times after that. We did the platelet-rich plasma multiple times. My office manager at the time, her dog was the first one we did the platelet-rich plasma. It was a little pit bull that had hip dysplasia and bad stifles, so we injected all the joints. We did it a couple of times on her dog, and we were very successful with that as well. Um, This shepherd, the first one I did, had really advanced disease, and was a very large dog, a little overweight, but responded beautifully. So what's the average cost? I really don't know at this point. When I did it, and I'm going to go back at least 15 years ago, the first time I did it, and his total bill, the initial harvest and concentration and re-injection was around 3,000 to 4,000. So I would bet in this day and age, probably by the time you do the anesthesia and surgery to remove the fat, get it concentrated, sent back, and re-injected with a second anesthetic protocol, you might be talking $4,000 to $5,000. But I would say you're going to have to find a regenerative medicine veterinarian or a specialty practice that is performing that. The platelet-rich plasma is less expensive. That can be done in any veterinary office, really, because it's not as specialized a procedure. However, if you are injecting into joints, you have to have a veterinarian who feels comfortable doing that. I would say the stem cell is probably more effective than the PRP, and it just depends, although they both help. It really depends how severe the disease is, whether your dog has enough or a cat has enough fat to be able to harvest for the stem cell, how advanced the disease is, and who you can find to perform the procedure. And also there's a cost factor because PRP would be generally much less expensive than the stem cell therapy. Can it be used for heart murmur with MVD? I don't know if they're using it for that. I haven't seen a lot of studies on that. Although now that you've asked that, and because of my own dogs, I may look into that, whether there have been clinical trials done for it. Most commonly, this is used for arthritis, degenerative joint disease, very, very common for that. It's being used a lot in human medicine. It's being used for spinal cord disease, spinal cord trauma, to try to help with regeneration there. The biggest problem with the nervous system, the brain, the spinal cord, nerves in the periphery, they are very slow to heal, very, very slow to heal. Some tissues in our body heal very quickly. The liver is one of those that heals fairly quickly. Kidney cells don't really regenerate. So it just depends on which tissue we're using it for. What is PRP? Platelet-rich plasma therapy. So that's where we extract blood, concentrate the platelets, and then inject it back into the area that we're concerned about. And also some is given intravenously. So thanks to the person who asked that question, because it is a really interesting topic. Regenerative medicine we're going to hear more and more about. And I think it can be very helpful for an awful lot of our pets. So everybody have a wonderful weekend. Supporters, I'm going to post. We'll do a Ask Me Anything tonight. I am I'm feeling lucid enough to actually be able to answer questions for the first time in a month. I don't know if it would be covered by insurance, Debbie Schwartz. It may not. Really, that is something worth asking your insurance company, because a lot of these insurance cat fight going on. A lot of these insurance companies are interested in doing these sorts of things, because it can be cheaper than things like total hip replacements and other problems. So years ago in 2010, your dog had PRP twice, then developed a rare cancer on her thymus gland. I doubt it's related. They do not use these therapies in pets with cancer. Because we don't want the stem cells to go to the cancer site and then say, hey, let's all multiply here. So, okay, everybody have a wonderful day. We get our music going correctly now. Pet care client has a Bernese who doesn't know he has to potty. That's a spinal cord problem. He doesn't have nerves to that area. I would find somebody who can do, first of all, get good radiographs, but I would find somebody who could do acupuncture and chiropractic, particularly if it's an older dog. It's probably lost the sensation. The nerves aren't working very well. There are herbs that can help with that as well. Yeah, consultations are still on hold. I don't even know where I am with that. We had to cancel everything the last 4 weeks, so way behind. Oh yeah, they are starting to use this and look at this for inflammatory bowel disease and digestive disorders, inflammation there. It can be used anywhere we've got inflammatory tissue in the body. Okay.